Biostatistics. Biostatistics, types of studies in health sciences. There are three main types of studies: experimental, observational, review. In experimental studies, you see randomized control trial, non-randomized design. Observational study is where you get tested the most, and in observational, you have cohort, cross-sectional, case control, and case studies. Review analysis, you have meta-analysis. Let's look at randomized control trial, non-randomized. In randomized control trial, you have random allocation into treatment and placebo groups, which means you did not segregate before looking into the studies. You just randomly allocated people in the treatment group and placebo group. And in non-randomized design, non-randomized means that you carefully took subjects and place them in treatment group and placebo groups. And in non-randomized design, you can determine efficacy of the intervention, which is also seen in randomized control trials. So in both trials, you can determine efficacy of the intervention. Let's look at observational studies, very high yield observational studies. Cohort study is when data is gathered from same individual over time, and it's a longitudinal type of study. And you can assess risk factor or outcome. So if the question in the vignette says you want to find out risk factors, they are probably asking you that, and they are hinting you that it is a cohort study. So remember, there is one individual and you are observing him at 1 year time, then 2 year time, and then 3 year time. Next is cross-sectional study. Cross-sectional study is when data gathered at one point in time can determine prevalence of an outcome in a population. So cross-sectional is when you gather data at one point in time. For example, you are gathering all the HIV positive results in 2019. So that would be a cross-sectional study. So let's say you want to analyze the prevalence of HIV prevalence in 2019. So you pick up results specifically from that year 2019 and you assess all the HIV results in that 1 year of testing. So that would be cross-sectional and you assess, determine prevalence. Let's look at case control. Case control study. What is case control? So for case control, you need to have case and control. So control is individuals who would not have any condition. And case would be individuals who have the condition that you are looking for. So, for example, if you are looking for diabetes, case control, in case control cases would be people who are positive A1C above 7.5%, and control would be who have A1C less than 6.5. So case control studies, case control cases who have the disease of interest. Control would be individuals who do not have the disease of interest. They can have, so if you're looking for diabetes, control would can still have um, hemophilia or any platelet disorder, but they specifically do not have diabetes because diabetes is the interest condition that you're looking for. And then case study is a detailed information gathered about one individual. Just one individual is involved. That is case study. And you can also use case study in a small group of individuals. So let's see what is review. Review study. Review study is used in meta-analysis when you're gathering data from multiple studies, and the studies are statistically combined and analyzed. So let's say that there are pool 1, pool 2, and pool 3. Pool 1 had 100,000 100,000 individual, and the study was statistically significant. P-value was less than 0.05. And same for pool 2 had like 200,000 individuals. Now, and pool 3 would have like, let's say, also 250,000, 250,000 individuals. All the studies were, in fact, statistically significant. When you are combining P1 plus P2 plus P3, when you are combining all these, this is called meta-analysis. So, coming to the next topic, temporality of different study designs, different study designs. So, um, clinical trial. Clinical trial is when you take a treatment group and a control group, and you are comparing these two groups, treatment and control, for an outcome of interest. For example, if you are taking two groups, one group smokes and you treat them with nicotine patch or nicotine replacement therapy, NRT, and the control group is who do not smoke, and then you are looking for outcome of interest. So that would be clinical trial. Clinical trial always is a small group, and they are always looking for short term analysis, like that only involves from days to weeks, doesn't cross more than a couple of months. So that would be clinical trial, something you can do in clinic-based practice. Let's see what is prospective cohort. Prospective cohort means when you take a group with risk factors, positive with risk factor, and one group without the risk factor. So when you compare risk factor with no risk factor and you are looking for a disease incidence to see if the disease occurred or not, that is prospective cohort study. And so you can look incidents in future, or you could look for incidents in the past. In the past, if you are going backwards in the time, like from now and then looking for incidents 10 years ago, that would be retrospective cohort. So a vignette about retrospective cohort would always mention that they are looking into records from last 10 years to look for incidents that occurred with certain risk factor, like looking for incidents of myocardial infarction in with people with risk factors such as smoking, diabetes, peripheral artery disease. So they are looking for a disease incidence back in the time, that is retrospective cohort. Let's see what is case control. Case control, case versus control. So you have cases and you have controls. So cases are disease cases, and then controls who have do not have that disease that you're looking for. And then you go back and you look for risk factors, frequency in time. So that would be case control. Case control study is also considered higher and more legitimized than clinical trial, prospective, retrospective cohort, definitely more than cross-sectional, because they have a control group. They are comparing to a control group. So if a question says that which of the studies, which of the two studies, sorry, which one study is best to conduct amongst all these studies, you will always pick case control because they have a control group, which is non-disease. So you are comparing cases with their controls. So that is a higher form of study. And then what is cross-sectional? Cross-sectional study always gives you prevalence. So you have risk factor and you compare them without the risk factor and you look for prevalence. Cross-sectional is something like if right now, um, all the people who are in the waiting area, and I'm trying to test their blood sugar level of all the people who are sitting in the waiting area, that would be cross-sectional. Next, to put these studies in a perspective of a chart. Let's look at how we are going to differentiate. So if you have two or more groups and you are trying to identify exposure and outcome of the study, and the exposure is given to you first in the vignette with exposure assigned by investigators, that would be clinical trial. So remember, clinical trial, which can be a clinic based. And so because clinical trial is in small group of people, in exposure is assigned by investigators, and you already know the exposure you're looking for, that is clinical trial. If you have outcome first in the vignette and you are still looking for exposure and outcome, and the study has a placebo group, then that is case control study. So let's see, if you are trying to determine exposure first, if exposure is given to you first and you are still looking for exposure and outcome, but you are not assigned the exposure by a investigator, that would be a cohort study. So in a cohort study, the exposure is not determined by investigators. And then exposure and outcome that is seen at one go, like at one point of time, you see exposure and outcome together, that is cross-sectional studies. So for example, if I'm checking blood sugar level of all the people who are in the waiting area of the clinic right now, that would be cross-sectional studies. And then what is case report and case series? So when you do not have two or more groups to compare, that is case report or case series. And typically case report, case series is in a one individual or just a very small group, right? So we already discussed cross-sectional study, and let's dive deep into cross-sectional study because it is frequently tested on the USMLE. So cross-section study is a design frequency, where you see frequency of disease and frequency of risks related factors that are assessed in the present. And you are always asking the question, what's happening? Okay, so what's happening is that you are looking for disease prevalence. And you can also show risk factors association with disease, but it does not establish causality. So prevalence, just for example, if I'm checking blood sugar level of 10 people in the waiting area of the clinic, and one of the person has blood sugar POC glucose of 160, doesn't mean that he has diabetes. So I cannot establish a causality. I cannot establish a diagnosis based on the spot glucose study that I just conducted. What I can look for is a risk factor, just a risk factor. Okay, so the major limitation of cross-sectional study is that the temporal relationship between risk factor and disease is not always clear. And in other study designs, a certain period separates the exposure from the outcome. So what is prevalence? Prevalence odds ratio is calculated in cross-sectional studies to compare prevalence disease between different population. So you remember what is odds ratio? Odds of exposure divided by odds of non-exposure. So odds of exposure divided by odds of unexposed, right? So this is odds ratio. So prevalence odds means that you have cross-sectional study that compare prevalence of disease in different prevalence of disease with odds exposure and between different populations. So that's prevalence. And so next is, what is case control study? Case control study means that you are comparing a group of people with disease to a group of people without the disease. And so control, case control will always test for odds ratio. So case control studies are analytical observational studies that retrospectively associate outcomes with specific risk factors. The researchers begin with selecting cases with a certain outcome. For example, multi-drug resistant tuberculosis infection and the controls without that outcome. Example, pan-sensitive tuberculosis infection. So remember, even the controls have um, tuberculosis infection, but because they're specifically testing for multi-drug resistance, the control does not have resistance. So again, case control studies, cases are multi-drug resistance. Opposite of resistance is sensitive. So in the control section, in the control studies, you do not have resistance, you have sensitivity to tuberculosis infection, so pan-sensitive. So that's how you identify um, um, case control study. So exposure status is determined by such activities as personal interviews and analysis of health records and lab reports. The critical distinction between case control and retrospective cohort studies is the order in which outcomes and risk factors are assessed. So case control studies determine the outcome and they look for associated risk factors. Retrospective cohort studies, however, ascertain risk factors exposure and then determine the outcome. So retrospective means looking back in the time. So you have risk factor first, and then you are looking for the outcome. Again, so in case control studies, we look for odds ratio. What is odds ratio? A case control study is used to compare the exposure of people with the disease to the exposure of people without the disease. So that is odds ratio. One easy way to remember odds ratio is odds of exposure divided by odds of non-exposure, unexposed. That would be controls. Okay, now moving on to outbreaks. What is outbreak phenomena in a case control study is when the design is appropriate to investigate an acute infectious disease outbreak. As it explores the association between exposure and disease can be conducted when the number of affected subjects is small and generally allows for quick localization of the outbreak source. So for outbreaks, to look for outbreaks. For example, if in a potluck picnic, um, 10 people participated in the potluck, and 10 out of 10 had watery diarrhea. Watery diarrhea secondary to Staph aureus or gastritis or E. coli, and it's a quick outbreak of diarrhea. In order to um, find out the uh, in order to find out the possible association of risk factors with the exposure, I have to be very careful what I use, the words I use. I cannot say diagnosis because you're not diagnosing anything. You are just relating risk factor to the exposure. So for outbreaks, you use case control study. Right. So, okay, so moving on, cohort study. Cohort study compares a group with a given exposure or risk factor to a group without such exposure and looks to see if exposure or risk factors is associated with later development of disease, can be prospective or retrospective. And then cohort study always measures relative risk. So relative risk is seen in cohort study. Smokers had a higher risk of developing COPD than non-smokers. That would be a cohort study. So cohort is always measuring relative risk. Smokers had a higher risk of developing COPD than non-smokers. So um, for COPD, relatively there's a higher risk of smoking association than people who do not smoke. So prospective cohort studies are analytical observation studies in which a group of exposed and unexposed individuals is followed prospectively over time for development of the outcome of interest. So cohort studies are considered stronger than case control and cross-sectional because of their greater ability to prove causation. So remember we spoke that cohort study has greater ability to prove causation because it has a um, control group to it. They have a control comparison with the control group. A retrospective cohort study is similar to a prospective cohort study, except that risk factor, exposure, and the outcome of interest both occur in the past and are assessed through review of records. Unlike a case control study, risk factor exposure is determined before the outcome and is known, thus allowing calculation of the relative risk. Okay, so retrospective cohort study is similar to prospective cohort study, except that the risk factor exposure and the outcome of interest both occur in the past. So if you are in 2025 and you're looking for past records going backwards from 24, 23, 2023 to 2000, that would be retrospective cohort study. So on the contrary, compared to retrospective, prospective cohort study, exposure and outcome have already occurred in the beginning of the study. Therefore, exposure and outcome status is ascertained retrospectively. Um, so in both prospective and cohort studies, however, there is follow-up exposed and unexposed individuals across time. So prospective, you're looking forward in time. Retrospective, you're looking back in time. Incidence and relative risk. A cohort study design is best for determining incidence of a disease, comparing the incidence of the disease in two populations with and without a given risk factor, allow for calculation of relative risk.